Thank you, everyone. Welcome and good morning. I'm glad people got the party started in the chat. First off, I want to thank Erica Marks and her team. You've met Fred and you've met Erica for helping us put this together today. We have, as was mentioned, a two-day meeting, and hopefully some of you contributed your favorite songs to the music playlist. It's been a fun time for us over the past few years. So my name is Michele Caggana, and I, along with Dr. Joanne Bedurtha, are co-project directors for NIMAC, which is the New York Mid-Atlantic Caribbean Regional Genetics Network. Our region includes much of the sort of Mid-Atlantic Northeast, including Delaware, Maryland, New Jersey, New York, Pennsylvania, Puerto Rico, Virginia, the U.S. Virgin Islands, and West Virginia. And you're going to hear a lot more about NIMAC throughout the next couple of days. But I definitely wanted to extend my welcome to you for our 5th virtual meeting. We have about 350 individuals registered for the meeting, and we're happy that you all could take the opportunity out of your day tomorrow to join us. We planned an engaging meeting, and we have many resources that are available, and you'll hear about a lot of the things that we've developed over the past several years that you can use in both your personal and your professional lives. And hopefully we can learn from each other, and we can learn from the stakeholders in our region as well. So here's a breakdown of who registered, and I'm happy to say that we have a large group of genetics professionals, families, and also public health who registered for the meeting and are joining us for this. Over the past 4 years, we've worked pretty hard to try and make sure that we have a diverse stakeholder audience, because we all have something to learn and we all have something to share. So our first poll of the day is going to ask where you're joining from. So if you could go ahead, and you should see on your screen a poll, and just let us know where you're dialing in or viewing from. And I'll do mine. Give people a couple seconds.
Yep, I can see the answers are streaming in here, Michele.
Okay, good.
So starting to slow down a little bit. So this is your call to action here to submit your answer and represent in 5, 4, 3, 2, 1. Okay, here are the results we have.
All right, we have representation from almost everywhere. Basically following along population lines for the most part. So it's kind of neat to see that we have representation from across the region. All right, thanks for that. Okay, so some of you may have heard, or many of you may have heard, that our networks are sunsetting for this funding cycle. So we've been very hard at work building sustainability, and you're going to hear about some of these things from Alyssa and throughout the day from many of our team members. And also we have a talk following Alyssa from Dr. Jeff Brosco. He's from HRSA, and he's going to talk about HRSA's plans going forward. And while change is hard, I also like to think of it as an opportunity. And so as in thinking about the intro here, I came up with an idea because I've been around for a while, and Dr. Bedurtha and some others on the line could also attest to this. Sometimes things change and sometimes they stay the same. So I have a short quiz for you, and I'd like you to get a piece of paper or open notepad or Word, and I have 3 quick questions that you can see if you can answer. So I'll leave them up here on the screen for you for a sec. All right. So you all sent your kids, a lot of you sent your kids to school, and maybe they had a test today. So this is your first quiz. All right, so here's some answers to those questions. So corn is an older version of the networks. It's called was called the Council of Regional Networks. And originally the networks were known as collaboratives. And so if you've been around since the early 2000s, you know we started off as collaboratives and now we're called networks. And the focus originally with the collaboratives was on newborn screening and transition and genetics. And so I wanted to just go over a little bit of that history to give you a sense of where we're coming from, and then bookend that with Dr. Brasco's look to the future. So CORN stands for the Council of Regional Networks, and it was established by HRSA, Health Services and Resources Administration, all the way back in 1985. And these networks lasted about 15 years. And the goal was really to coordinate activities amongst different networks across the country and work in the areas of quality assurance, data collection, and education. It was comprised of 2 members per region, and then there were other representatives that were from various stakeholder groups, such as providers, public health, and consumers. And there was also a newborn screening committee, and this committee was charged with all things newborn screening. And there was also a data collection project that looked at genetic service delivery as well, and actually quantified it across the various, across the country and across the various networks. And so as time went on, CORN kind of sunset. And then in 1999, they awarded grants to states to develop a genetic plan. So the first HRSA planning grant were sort of planning grants. And then after that, there was a competitive grant to implement these genetics plans. And then in about 2004, they kind of ended that effort and moved back to the regional genetics collaboratives. And that's sort of where we all came in. Some of us have been around for a while here. And these were focused again on genetics, newborn screening, and transition. And that established also the National Coordinating Center, which was awarded to the American College of Genetics and Genomics. And then also there was a family component that grew out of the Newborn Screening Saves Lives Act, which today we know as the Family Center. In 2017, the Association of Public Health Laboratories was awarded a large grant from HRSA called New Steps. And this focus was on newborn screening and technical assistance and evaluation. And so the newborn screening component of the collaboratives was sort of carved out when they became networks. And the focus of the networks moved towards genetic service delivery, availability of services, and telehealth. And so that's sort of the evolution. And so I hope you see sort of a pattern to this history. So some of you might remember this slide if you were with us from last year. And I just want to sort of take a breath and remember that while the networks might be sunsetting, we at NIMAC are working, and across all of the networks, are working to preserve resources that we as a community built for you, and that were built by you, that we all can rely upon. So as I said, sort of stay tuned to hear some more about that throughout the next 2 days. I wanted to thank the planning committee for their help with this meeting. They really helped to build a resource-focused meeting that is, there will be a lot of review of what we have and also a look forward. We are fortunate to be able to offer CME credit through the American College of Medical Genetics and the ACCME. So the learning objectives for this are up here on the slide. We would like to be able to summarize resources that can be used in managing patients and genetic conditions and make those available to primary care and other providers. Also, benefits and opportunities for broader engagement. This is one of the major drivers of what NIMAC has been doing over the last 4 years. And also identify opportunities for collaboration and sharing of resources between NIMAC and all of you who are in the quote room. A quick review of the agenda. We have an early networking session. We have that on both days. And next, Alyssa will talk to us about a look back and a look towards the future. And then, as I mentioned, Dr. Brasco will share HRSA's vision for the future as well. We have scheduled a decent lunch break for you to kind of catch up with what you need to do. And then after that, our team is going to share some of the resources that were accomplished via a state team's approach. We'll next hear from Rosani Sanchez, and she's going to share resources for language access. And this session will be given in Spanish, and English speakers will be listening to the translation. So it's a very interesting presentation that way. Next, you can join us to learn about resources for rare diseases and genetics. And then Dr. Bedurtha will close out day one, and then we'll have breakout rooms available for you to continue talking to folks. Day two, again, we will have the early login, and you will then hear ways to embrace change. And then we will have concurrent sessions. So you can choose from one of two that are listed here in the third bullet. And then feel free, you can grab some lunch. And we have 4 industry sessions, and I'll show you the topics in a moment. And you can choose from one of each of those. And then in the afternoon, we'll have 2 more concurrent sessions. And these are quite interesting. One is resources for telehealth, and the other is a presentation on the power of a story. And then Alyssa will help us move forward so that you can create your own next chapter. And then Dr. Bedurtha will also close out day 2. The next series of slides are ones that we need to show in order to be able to offer CME credit for this activity. It's from the Accreditation Council for Continuing Medical Education, or ACCME, who also worked with the American College of Medical Genetics. So I wanted to thank all of our speakers for fulfilling all the requirements so that we can offer this benefit to our attendees. This two-day meeting will be eligible for 11.25 credits, and you have until May 24th to submit your claim to get your CME credit. The next slide just shows sort of the process of financial disclosure to make sure that our presentations that are scheduled are free from bias. These are available on our website too, if you would like to read more about those. And then the next 3 slides are just all of the speakers and what their disclosures or relationships were as they reported. So here's 2. And then the last set. And again, this just reiterates how to claim credit, 11.25 and until May 24th of 2024. After that, they won't accept claims for credit. For the genetic counselors that are attending, we've gotten approval to offer CEU from the NSGC, and this is eligible for 10 Category 1 contact hours. The instructions are here. Basically, you have to be logged into the actual Zoom website. You can't just sort of call in remotely and not be on the Zoom. You have to document attendance and fill out an evaluation. If you want a PDF of the evaluation so that you can sort of jot down your notes throughout the conference, you can email nymac@fair.org. And you need to have a user ID. We were able to subsidize this by only charging $10 for the CEU credits. And if you forgot to purchase CEU, so you're registered, but you forgot to purchase, you can email nymac@fair.org, and Pat will make sure that you're billed via PayPal. And if you have questions, you can email Alyssa at the nymactelegenetics@gmail.com. We'll put up more information about this in the chat. You'll get reminders about this as well. And it's also, like I said, on our website for further instructions. This is our industry sessions. So we have, as I said, 4 vendor sponsors or industry sponsors who contributed funds and are giving talks during the sort of after that lunch until 1:50. So we have 2 concurrent ones. One is 12:40 to 1:10. The other is 1:20 to 1:50, and you can choose from one from each. We also have resources available from Zevra, and more information about this is on the website that is shown here at the bottom, and we'll have that in the chat as well. So just some housekeeping. Again, you were sent a link, but everything regarding this conference is on our website, and it will be posted throughout the conference as well. All of the open sessions are being recorded, but the conversations in the breakout rooms don't get recorded. And recordings will be available for everyone after the meeting, but you will not be able to just listen in order to get credit. You have to, as I said, be on the website for it. All of our slides have been translated into Spanish, and they're available on the website and can be downloaded from the NYMAC website. And we are monitoring the chat. So if you have questions or concerns, we will address them. We can answer questions for you. And then something cool that we came up with this time is a live meeting notebook in Google Docs. So if you think of something, you want to share resources, you have a comment, you can jot them down in our electronic notebook, and that will be available after the meeting. And there's a link that we will put in the chat that will kind of bring you right to that notebook. If you can keep it open on your computer and kind of use it as an active resource sharing tool. And as I said, we have all kinds of information for you that will be posted continuously throughout the meeting. So pay attention to the chat. Wrapping up here, what are attendees looking for? Most people are looking for new resources, medical information, and exposure to different perspectives, which is always helpful. And then we have one attendee who wants to share resources with patients. And so that was a new one this year. So just a few quick thoughts. As I mentioned, hopefully most of this meeting, except for my early faux pas, will be seamless. It takes a village to pull this off and make it appear seamless to all the attendees. And we're very happy you could join us today, especially to Pat and Alyssa, who worked tirelessly for many months. We started planning for this meeting shortly after last April when we finished up last year's meeting. Again, thanks to Erica, Fred, and the team. Who will be on board for technical assistance and making this enjoyable for everyone. We are going to have an evaluation and will be provided to you. So please fill it out and let us know what you thought of our presentation this over the next 2 days. And as you've already saw, we have some fun activities. We also have some prizes, so stay tuned for those. And various activities that are built in to keep people engaged and let you participate and have some fun too. Enjoy the music and check out our website. So I'd just like to end before we head to a breakout, acknowledging HRSA for the funding over the past several years, the National Coordinating Center and FACMG for allowing us to offer CME credit, the Family Center for their cooperation over the years, the advisory committee from NIMAC, our staff, Dr. Bertha for co-directing with me, and then Dr. Poirier, Sylvia Mann, Dr. Thorell, and Dr. Watson for that historical walk down memory lane, and then each of you also for coming. So that will wrap up my end, and I think we're heading to a breakout.